Without further ado, let's all be upstanding as we welcome the Cabinet Secretary for Health, Honorable Aden Duale, to be able to address us. Waziri karibu.
Thank you. President, be seated. Governor Cecily Mbariwe, the Minister of Health. I'm not a doctor, but I read. I sometimes know things more than even my colleagues, doctors in MOH. I don't know how greed and money can even destroy a healthcare system. So I'll tell you, we have a lady who delivered in 1 year 10 times. We will give you the name. You saw the president saying there's a patient whose leg was amputated 10 times. Unaona wamama badala ya kujifungua kawaida wanasukuma kwa C-section. Kwa sababu C-section unalipa 30,000. Unaenda hospitali uko na tuhone homa ya ile outpatient, unatritiwa, unachukua dawa, unaenda hiyo hospitali inakulalisha, inakwambia it turns you from an outpatient to an inpatient. It's called upcoding. Am I right? Yeah, that used to happen. Thank you very much. I think I'll give it back to CEO of Joyce, then we launch the document.
Thank you so much, Waziri. Makofi kwa Waziri.
Much, yes.
Hi, hello family, welcome to the Koya Diaries, and if you're seeing me for the first time, my name is Koya Mtambo, and today we are at KICC again, where we are joined by the President of Kenya, His Excellence Dr. William Ruto, and the Health CS, Dr. Aden Duale, and we are going to address key issues under the government's Taifa Care agenda and progress towards universal health coverage. And to me, as one of the healthcare workers, it was an opportunity to understand where the country's healthcare system is headed, the progress that has been made so far, and what still needs to be done to the universal health coverage reality for every Kenyan. Yeah. And while there, the conversation majorly highlighted the progress being made under Taifa Care, the importance and the need for a healthcare system that puts patients at the center, while ensuring that healthcare workers have the support and resources they need to deliver quality services. The CS also addressed the deep-rooted corruption, fraud, and systematic weakness that characterize the health sector under the former NHIF system. He highlighted how some facilities manipulated the system through upcoding and fraudulent claims, admitting patients who should have been treated as outpatients simply to receive a higher reimbursement. In some shocking cases, facilities reportedly submitted claims indicating that the same woman had undergone up to 10 C-section deliveries within a year. My goodness. And as if that was not enough, another patient was allegedly recorded as having had a leg amputated 10 times in 1 year. A clear example of how the system was being exploited to siphon public funds. This is Kenya for us, yeah? These systems clearly exposed just how rotten and vulnerable the health financing system had become, with technology gaps and weak data systems making it easier for fraudulent claims to go undetected, yeah? So the CS explained to us that the government has since been working to address those loopholes through better technologies, integrated systems, real-time data, and stronger verification mechanisms. So this will make it much harder for facilities to manipulate patient records and make fraudulent claims. So the shift is therefore not only about changing the financing systems, but also about using data and technology to improve accountability, transparency, and efficiency in healthcare while ensuring funds and funds are directed to genuine patients and genuine medical systems. So welcome guys, sit back and watch the full conversation and hear directly from the Cabinet Secretary for Health. That was just a brief summary of the key issues, but there was much to the conversation. Also subscribe to the channel if you haven't, like and share your thoughts in the comments.
After that, we got into a panel session, and that's what we had just started. So I would like to request Dr. Patrick Amoth, DG, to come so that he can then welcome CS. Thank you.
Thank you, Dr. Amishwe, Cabinet Secretary for Health, Honorable Aden Duale, Your Excellency Governor Cecilia Barire, Embu County Governor, senior officials from the Ministry of Health, ladies and gentlemen, good afternoon. We are here to affirm the progress that we have made as a country in terms of our digitization journey. And we are sharing this good news with members of the public that reforms delivered health as a right, a commitment that His Excellency made, and in terms of now demonstrating the progress. And there's no better ambassador to speak for us on this rather than the counties themselves. You've seen the progress that Mombasa has made, the progress Embu has made, and many other counties. We are on track towards becoming the first country in the African continent that will move away from the periodic 5-year surveys, basing our data and decision making on events that happened 4 or 5 years before to real-time decision making. It is a great day today because we are also going to launch critical documents that will enable us shape forward our progress in terms of our digitalization journey. Without further ado, let's all be upstanding as we welcome the Cabinet Secretary for Health, Honorable Aden Duale, to be able to address us. Waziri karibu.
Thank you. President, be seated. Governor Cecily Mbarire, DG, directors, good delegates. I think the digital health side event today, unlike before, and those of you who were around during COVID, you remember during COVID, we used to look for, we didn't know even how many ICU beds do we have as a country. We didn't know. So you have to call Kenyatta, you have to call this. Today, because of digitization, we know how many ICU beds do we have the whole country. We know the occupancy of those ICU beds. And you will be told through this digital transformation, superhighway, where the availability of those beds are. Today, from this digital superhighway, we can tell the bed occupancy of Kenyatta National Hospital. And the CEO will be advised that you are at red. You either discharge some patients who are okay, or you refer the next patients who come to the next facility. A lot of people, they don't know the value of digitization. I'll give you a practical example. Under the former NHIF, close to 1,800 plus people were working. That number has been reduced to 800 when SHA came into being. So the other 1,000, their jobs have been taken by technology. How? Before, the claims of NHIF used to be done at the county or at the district. Then the whole load of documents are sent to the regional NHIF office. Then the whole regional office will send to NHIF building. But now you can lodge your claim. You can use your app to know which facility is close to you. You can find your doctor if he's available. You can find if the person treating you has the right qualification. You can find we can trace a patient's medicine to a manufacturer. So the key objectives of this session, which was given by Her Excellency, says, first, I think we wanted to highlight how digital health initiatives have improved efficiency in the service delivery within the health ecosystem. That's number one. Two, I think the team led by Anthony and Dr. Joyce and the rest of the team here from DHA, they wanted to demonstrate how real-time data can support, evidence-based. Sometimes if you get data very fast, then you can make a decision. Welcome our CHPs. Yeah, let's clap for them. Even them very soon they don't know. We shall be tracking them digitally. We are not giving them the story. We shall be tracking them digitally from morning to evening. How many households they have gone to, how many people they have seen. Mnanisikia? Hata nyinyi tutatumia teknolojia, tutajua mama Mukami somewhere in Nyeri or Halima in Kwale, how many households she has visited. And that's why Monday is good, Anthony, to hear. Thursday you must get the data from SHA. I am paying you so that these people can get the premium shift. I have been given very strong instruction this morning. I said by 10 o'clock Monday, DHA will send them text messages that you are SHA. Am I right? But as we give you that, Mjue pia digitally we shall monitor you. So that if you say you have seen a patient in real time, am I right? Yes, yes. Also, I think this session was showcasing how technology serves a very critical catalyst for achieving universal health coverage. Good people, this universal health coverage is like a house when it was being built. So the two biggest beams that are holding this house, called UHC Taifa Care, from where I sit as a minister of health. I'm not a doctor, but I read. I sometimes know things more than even my colleagues, doctors in MOH. These days you don't have this. Umeona kitu inaitwa card ya NHIF? Umeona? Hakuna, there's no card. It is your thumb. And because of your thumb, you can't forget. Zamani walikuwa wanasema ati nimesahau kadi ya NHIF. No, saa hii ukikuwa mgonjwa akali. Mtoto wako wa shule akiwa Kisumu, between the age of 7 and above, he just needs to go to a hospital. He doesn't need to call his mother or father. Aseme tu ID card ya baba ama mama, ikiwekwa jina ya watoto yako yote itatoka. Huyo kijana ataambia mwalimu, this is your name, yes, atatibiwa. That's how digitalization has really improved. And finally, we want to assess whether digital health has made various health systems building blocks stronger today than the previous year. And that one I can tell you myself. By what we saw, if you go to the stand of SHA or DHA, you can be told since SHA started, 1.3 million women delivered. It will give you how many delivered, normal delivery, how many were through C-section, how many died, their names, their telephone numbers, their ID number, the facility. Before we couldn't do that, but we can do it through digitalization. So I think the overall this session will help us, participants, to have a reflection on whether digital transformation of health system has delivered measurable. But finally, digitalization has helped us to deal with the fraud. Yeah, fraud. You saw the president saying there's a patient whose leg was amputated 10 times. I'll tell you, we have a lady who delivered in 1 year 10 times. We will give you the name. Mama amekuja tu, iko invoice yake, amelipwa NHIF ama SHA. Unaenda hospitali, uko na tuhunde homa ya ile outpatient, unatritiwa, unachukua dawa, unaenda hiyo hospitali inakulalisha. Inakwambia it turns you from an outpatient to an inpatient. It's called upcoding. Am I right? Yeah, that used to happen because unaona wamama badala ya kujifungua kawaida wanasukuma kwa C-section, kwa sababu C-section unalipa 30,000. Normal delivery, I don't know how greed and money can even destroy a healthcare system. So digitization is a way to go, and it has really helped our country. It monitors. Finally, let me give you an example. You know, people don't know. When we were starting SHA, I think we were about, hata tukufikisha 5 million. I was with the president, we went to Egypt. Egypt has a population of 100 million people. At that time, they were at 6.5 million registered with the universal health coverage. I went back 2 months ago, over 9 million. When I told the minister, who is the deputy prime minister, I told him we are at 30 million. He woke up from his chair and he told me, how have you done it? And I told him, we don't assemble our citizens somewhere. As we sit here, Kenyans are registering. Kenyans are registering, they are paying. In fact, if you check, you can tell me, since the president left, around 2 o'clock and up to now, how many have registered? And how many have paid? And how many Kenyans have been admitted in ICU? And how many Kenyans have gone to this facility? Kenyatta, I can tell him, since morning, how many patients have gone to Kenyatta Hospital. The CEO doesn't need to be told story. At the button of his computer, he can do it. In South Africa, universal health coverage. When I asked the minister, he told me I am still in court. Bado anang'ang'ana na sheria, amepelekwa kotini. So our country is great. We must talk about the positive things. When we say we have 107 CHPs, even the Director General of WHO, Dr. Tedros, says 107,000. Other countries have 2,000. So all this is happening because of digitalization. Thank you very much. I have been the biggest advocate of DHA and the people and the team that DHA is the face, but there's a team that work with the consortium, and I am proud of them. A consortium led by one of our best companies, telecommunication company Safaricom, and they're here. So you can see, Kenya must lead others to follow. So the team around here, Dr. Anthony says, one thing I have learned is you must surround yourself with intelligent people if you want to succeed. This health summit, if it's going to be A, it's not me. It is the team that I work with, who I have a feeling that, particularly DHA, even today you will see when the president was at the booth, it was different from the DG always tells me, I think you are a bit biased to DHA. You are a bit biased to SHA. But I tell him, you know, the big pillars are DHA and SHA. So if this was, if I have to manage them because they can make the house collapse. But we are doing very well. The same now through DHA, we know how many mothers are dying, how many neonatal, how many postnatal, to make sure that we reduce maternal and newborn deaths. Thank you very much. I think I'll give it back to CEO or Joyce, then we launch the document.
Thank you so much, Waziri. Makofi kwa Waziri. Waziri and Your Excellency, now, because we have broken this part, we want to lead you to where the documents are. Waziri, we just want to lead you to where the documents are. We'll do the launch, and then we'll continue with our programs once the leadership has left. These are documents that are very key to our data governance. There are also very key standards, which systems are authorized to provide services in line with our law. Was there?
So today we are launching 4 documents. We are launching the Kenya Health Enterprise Architecture that defines the superhighway, the Kenya Health Data Governance Framework that talks about Digital Health Strategic Plan 2025 to 2030. Let's clap. And then the Digital Health Solutions and Standards. Thank you very much. Thank you very much. You can see all the documents as they are rotating there. Fantastic. Thank you so much. Yes.